Occipital encephalocele is a rare neural tube defect where a portion of the brain, along with its surrounding membranes, protrude through an opening in the skull. This opening is typically located at the occipital region. This is the most common area, which is at the back of the neck, of course. Using 3D and 4D ultrasound, we can clearly visualize the extent of the protrusion and evaluate the structure of the protruding brain tissue. This information is crucial in understanding the severity of the condition and planning appropriate management, both prenatally and postnatally. How 3D and 4D ultrasound contribute to the diagnosis of occipital encephalocele. Using 3D ultrasound, we can identify the characteristic sac-like protrusion extending from the posterior aspect of the skull. This sac may contain brain tissues, cerebrospinal fluid, or both. The three-dimensional imaging capabilities provide a detailed view of the defect, allowing us to accurately assess the size of the sac, the extent of the skull defect, and the position of the involved brain tissues. Meanwhile, 4D ultrasound introduces the elements of dynamic imaging. This enables us to observe the movement and behavior of the brain within the sac in real time. It also provides insights into any deformities and their interaction with adjacent cranial structures. Both together, 3D and 4D ultrasound give us a comprehensive understanding of the anomaly, aiding in accurate diagnosis, prognosis, and planning for intervention when necessary. Now let's explore how these key findings guide clinical management. Key ultrasound findings associated with occipital encephalocele. These findings provide critical clues for diagnosis and can be effectively visualized using 3D and 4D ultrasound imaging, as well as 3D, of course. First, there is an abnormal head shape, which is often observed, particularly at the posterior aspect of the skull. This irregularity is a significant marker prompting closer examination of the cranial structures. Second, we may detect visible herniation of the brain tissues, which could involve part of the cerebellum, cortex, or other regions of the brain. Identifying these components within the sac is essential for assessing the severity and potential complications of the anomaly. Finally, there is often an absence of the raw skull bone contour at the occipital area. This defect creates the opening through which the brain tissue or cerebrospinal fluid protrudes, a hallmark characteristics of this condition. These findings, when combined with the imaging clarity offered by 3D and 4D ultrasound, enhance our ability to diagnose occipital encephalocele accurately. In the next section, we'll discuss how these diagnostic insights influence clinical management and strategies. Occipital encephalocele is not always an isolated anomaly. It can often be associated with other conditions that further complicate the clinical picture. These associated conditions may include craniofacial malformations such as facial asymmetry or midline defects, which can coexist with the occipital skull defect. Hydrocephalus, which is characterized by an abnormal accumulation of cerebrospinal fluid in the brain, leading to increased intracranial pressure and enlarged ventricles. Other tube defects, such as spina bifida, which may indicate further disruptions in neural tube development. Recognizing these associated conditions is crucial as they can significantly impact prognosis and management decisions. Advanced imaging with 3D and 4D ultrasound allows us to detect these concurrent anomalies early, providing a more comprehensive view of the fetal condition and informing a multidisciplinary approach to the care. Let's now discuss management prognosis for occipital encephalocele. The prognosis for this condition is highly variable and depends on two key factors: the size of the skull, and the second key factor is the extent of the brain involvement in the protrusion. In cases where minimal brain tissue is involved, the prognosis may be more favorable. However, if critical areas of the brain are included, the condition often leads to more severe neurological deficits. Management typically involves surgical intervention after birth to repair the defect and reposition the brain tissue if possible. This surgery aims to prevent further damage, reducing the risk of infection, and restore the integrity of the skull. Despite surgical advancements, the long-term outcomes vary widely. Some children may achieve a good quality of life with appropriate care, while others may face challenges related to the developmental delay, motor impairments, or other neurological issues that may arise. It's essential to provide families with comprehensive counseling to set realistic expectations and prepare them for the potential outcomes. Early diagnosis through 3D and 4D ultrasound plays a pivotal role in enabling timely planning for delivery and postnatal care. Now we will jump into the next anomaly. To further enhance our understanding of occipital encephalocele, we have prepared a detailed video presentation. This video will walk you through the condition's key features, including its appearance on 3D and 4D ultrasound, associated findings, and the clinical considerations we have discussed so far. I encourage you to pay close attention to the imaging examples and explanations, as they will bring clarity to how this condition is diagnosed and managed in real-world clinical settings. Let's take a look at the video.